guys, welcome back to my YouTube channel. My name is Guinea and I am a registered nurse. And on this channel we are discussing about the NCLEX, pharmacology and all the nursing concepts. Today's topic is very important for the NCLEX point of view, in which we are discussing about the all types of diet plans for all types of diseases. So let's start with that. If the patient is having hypertension, avoid processed foods, canned soups, and give the patient low sodium diet including high fruits and vegetables. In the heart failure, avoid salty foods and give low sodium and fluid restriction diet to patient with small frequent meals. For the patient with diabetes, avoid sweets and sugary drinks and give consistent carbohydrates with high fiber. In COPD, avoid gas-forming foods and give the patient high-calorie and high-protein diet in small frequent meals. In stroke, avoid thin liquid diets and give thickened and soft diet. In cirrhosis, avoid alcohol and give low sodium and moderate protein. In osteoporosis, avoid excess caffeine and give high calcium with vitamin D. In peptic ulcer disease, avoid spicy food, alcohol and acids and give bland diet with small frequent meals. In celiac disease, avoid gluten and give gluten-free diet. The patient with Parkinson's disease, avoid high protein with levodopa while you can give the protein later in the day. In coronary artery disease, avoid fried food and red meat and give low fat, low cholesterol and high fiber diet. And in hypothyroidism, give normal iodine intake with fiber and avoid any type of raw vegetables. And in hyperthyroidism, avoid caffeine and give high calorie and high protein diet. For the patient with kidney stones, avoid spinach and nuts and give increased fluids and low oxalate foods. In tuberculosis, give high protein and high calorie diet. In multiple sclerosis, give balanced diet with high fiber. In gastroesophageal reflux disease, avoid chocolate, caffeine and spicy foods and give small frequent meals with low fat. In diverticulosis, give high fiber diet and in diverticulitis, give low fiber diet. In ulcerative colitis, give low residue during flare and high protein diet. In chronic kidney disease, avoid bananas, dairy and nuts and give low sodium, low potassium, low phosphorus and protein restriction diet. And in acute kidney injury, give high calorie and low protein diet. In HIV AIDS, give high calorie and high protein diet. In gestational diabetes, give controlled carbs and high fiber. And in hyperemesis gravidarum, give small frequent meals and dry foods. In MI, avoid heavy meals and give small frequent meals with low fat and low sodium. In peripheral vascular disease, give low fat and low cholesterol. In diabetic ketoacidosis, the patient will be NPO initially and then progress to diabetic diet. In hyperlipidemia, avoid fried foods, butter and give high fiber and low saturated fat. This is very important. In Addison's disease, avoid low sodium diet and give high sodium and high protein. And in Cushing syndrome, give low sodium, high protein and high calcium diet. In dumping syndrome, give high protein, low carbs and no liquids with meals. And in Myasthenia gravis, give soft foods. In iron deficiency anemia, give high iron foods and avoid iron with milk. Most repeated question. For burn patient, give very high protein and very high calorie diet. If you remember these diets, NCLEX cannot trick you. Save this video and revise this before your exam. And subscribe for more NCLEX questions. Next video is even more important.